So how does neuropathy happen? In short, the nerves become highly dysfunctional in and of themselves because of hyperglycemia, so too much sugar floating around. Some of the sugar goes down a metabolic pathway called the sorbitol pathway, and then you get excessive amounts of sorbitol in the tissues, which is toxic in and of itself, but a lot of that sorbitol is then converted to fructose, which is extremely toxic to tissues. Fructose and hyperglycemia lead to the formation of what are called advanced glycation end products, and these are abnormal proteins that glom onto the connective tissues and make everything very stiff, makes the mitochondria not work well, increases your levels of inflammation and oxidative stress. And sadly, neuropathy is going to affect 30 to 50% of diabetics at some point over time, and probably 100% if you consider early and low-grade neuropathy. Autonomic neuropathy is the sympathetic system, so the system of nerves that you never think about. And then you'll get altered sweating, you'll form calluses, you'll get cracked skin. These are people that have GI issues like gastroparesis. That's a form of autonomic neuropathy, and we're going to talk about that briefly too. All this needs to be looked for, but the fundamental underlying problem is too much sugar in the blood, insulin resistance, this sorbitol pathway, and then the resultant inflammation and oxidative stress that damages the nerves.
Quick question for you.
We have a question.
What about taking berberine for a diabetic that takes metformin and
Glipizide? Somebody's asking if they're taking prescription metformin and glipizide for diabetes, would they or should they add berberine? I've had patients do that successfully. I would just say check with your physician, because you may be so well managed or tightly managed that if you add another method of dropping your blood glucose, it may go too low. But I have had patients use berberine in conjunction with their prescription meds. I would just check with whoever's treating you, and or if you have a continuous glucose monitor or some way to check your glucose, just test yourself, in a safe environment with somebody around in case you do become hypoglycemic a bit, okay?
Maybe just recap with berberine.
Berberine is a very effective, all natural medicine derived from some bark of certain different plants that is a direct mimicker of metformin. So it's essentially metformin, but in a natural form, in the way that it behaves in the body. So a lot of people that are unable to get metformin will take berberine because it's cheaper, it's all natural, and it's available over the counter.
Thanks, Missy, for sharing, and anyone else can share the talk too.
Oh, thank you, Missy, for sharing the talk, and please do share this with anybody you know that is diabetic, pre-diabetic, or God forbid has a diabetic foot wound. So remember I told you we're going to talk about autonomic neuropathy. This image, if you can see it, depicts all of the organs that are affected by autonomic neuropathy. So remember, your nerves are touching every single part of you. You just aren't aware of a lot of it, right? We're aware of some of our nerves, the somatic system, but not the autonomic system. So autonomic neuropathy is missed all the time, a lot of times because patients aren't going to tell you the symptoms unless you ask and know to ask for them. So I ask them about sweating. We ask about erectile dysfunction, arrhythmias, orthostatic hypotension, constipation, gastroparesis, nausea, diarrhea, neurogenic bladders, and then secretomotor dysfunction, which is altered sweating as well. All of these things are signs of neuropathy that is either there or about to be there. So just if you have any of these symptoms and you're diabetic, you may want to start thinking about getting a workup for neuropathy. All right, so again, what is neuropathy? Just think of it as nerve damage at the cellular level, and then the electrical system is just kaplooey. It doesn't work right, okay? Sometimes it's because there's poor blood flow to the nerve because of the peripheral arterial disease associated with diabetes that we talked about. Sometimes it's the increased sorbitol and the toxicity that damages the flow and damages the myelin and slows down the conduction. Sometimes it's the intraneural or inside the nerve accumulation of these advanced glycation end products, or these abnormal proteins that form in the setting of too much sugar in the blood. And then what happens is you'll get balance problems, so you're a fall risk. And then people become depressed. Sometimes they get pain, and then they have all of those autonomic symptoms we talked about that nobody can really figure out or explain to them. And all of this just, it adds on each other. And I've seen patients just get so upset and miserable because A, they don't have an answer, they don't understand the connection of all of it, and nobody's really managing it properly for them. So if you have any of these things, you're feeling moody, you're a little bit down, you have pain, you've got balance problems, you notice you're very stiff, you notice you can't even bend over and touch your toe, you can't even like bring your foot up to cross your leg to tie your shoes. All of these things are showing you that you may be having dysfunctional connective tissues and things like advanced glycation end products, oxidative stress, chronic inflammation. All of it's treatable, it just needs to be recognized.